I wanted to tell you about a patient I saw earlier today. She was a 41-year-old female, is having multiple problems. She came to me after being hospitalized varying times for nausea, some vomiting, weight loss, feeling terrible fatigue, brain fog. She said, "This isn't me." She also had urinary tract infections continuously. I was placed on antibiotics. She had stomach pains, the garden variety things that I see every day. The walking wounded, as I call it. The first time I see a patient, we do very thorough lab work. I checked her for a variety of things. What we found is that, first of all, she had an overgrowth of a bacteria that should be in the gut, in the bowels, called Klebsiella pneumonia. In fact, it was in very high levels. So this is something we will address that hopefully will then improve her GI tract health and wellness. The other pertinent information about her gut testing is that she had significant leaky gut syndrome, which is also known as intestinal permeability, which is when the gut becomes too permeable and allows for what's called macromolecules, or large particles of foods, to get absorbed abnormally into the body, and this causes significant inflammation. Can also be associated with autoimmune disease. Third thing she had is we found that she had some mycotoxins, which are mold toxins, and when I questioned her about this, she said, "Oh yeah, one of the windows in her basement used to leak and they had it remediated." But it's very important we ask our patients about things in their home and did it have some water damage, because you can have mold mycotoxins that are contributing to brain fog and fatigue and gut problems and a variety of other symptoms. The next thing we found is she had high levels of Bartonella, which is a co-infection to Lyme disease. So we're going to be addressing the Bartonella as well, and I placed her on a comprehensive regimen between dietary recommendations and different kind of herbals and supplements and other health-enhancing phytonutrients and substances that I'm hoping will now bring her back to health. In fact, she's no longer having the vomiting that she was having when she first came to me as we started her on different treatments about a month ago. We're very excited that we found some things that the hospitals typically don't even assess, don't look at. We take a much deeper dive and we're seeing our new patients because they're complicated. We have to do that. And just doing what's called a CBC or a chemistry profile is simply not enough. And so my office, we often will go further steps if indicated, and we'll often look at their gut flora. We'll look at intestinal permeability. We may look for Lyme and co-infections or for mold toxins and a variety of other things as well. So I'll keep you posted, but this was an interesting case, at least as to how we think about things here at our office and how we take a comprehensive, holistic approach in guiding patients' healthcare. Thanks for listening.